the group in terms of the pandemic, the vaccine, all the latest developments. Also, as part of our dynamic duo, we have Pam Godwin here, and Pam is the head of our healthcare committee. She is also a retired nurse practitioner, physician's assistant with a specialist in gerontology. Pam ran her own practice for a while, and she brings to us a wealth of knowledge that we've always been very fortunate to be able to take advantage of. Pam has been helpful on the board for a while and head of the healthcare committee, and has enabled us to kind of decide how we wanted to run our programs, how we wanted to set up as the pandemic hit, where we were going to go with this, how we could safely assist our members, which is, of course, any village's priority. And we were able to do that thanks to both Pam and Resha and our healthcare committee. And so rather than take up any more of your time, I would like to offer you, Pam and Resha, to introduce themselves, and we will start our program.
Pam, why don't you start?
I'm Pam Godwin, and I'm a member of the Healthcare Committee. And as Lynn said, I'm a retired nurse practitioner, retired Lieutenant Colonel in the Army Nurse Corps, retired co-owner of a primary care practice, and now happily I have a puppy that's my primary care responsibility at this time. But I am very excited and very interested to share the information that Resha, who I so appreciate and honor her scientific PhD background. And Resha's going to start.
And I'm Resha Putzrath. My degrees are actually in physics and biophysics, but my first lab job in 1967 was a virology job. My doctoral thesis in biophysics had to do with virology. And my last job was with the Navy Marine Corps Public Health Center as a toxicologist, because I'm a board certified toxicologist, and a quantitative risk assessor. So Lynn, if you could put up the slides, we can get going.
Okay, so as you were speaking, I was doing that, and of course the slide just shut. As you said, you could get going.
Of course. So I will also say, while Lynn's getting us set up, that I usually say that I'm a physicist by training, a board certified toxicologist by profession, and an iconoclast by temperament. Because in 3 different areas of biomedical science, I've proven 10 years of the literature to be incorrect, which is fun in a way, but it's a devil of a time getting your stuff published. That can be another talk some other time if people are interested.
Okay, and we are actually now good to go. And so let me share my screen, and we will ask if you have questions that you either electronically raise your hand. Everybody is muted. We will ask that you stay muted during the presentation. And of course, you can unmute afterwards to ask questions.
The other thing I want to mention is both the recording and the slides are going to be available afterwards. So no one has to take notes on anything that you may find of interest or websites that are cited. You can get all this afterwards. So just feel free to listen.
Exactly. Thank you. And so you will be able to access the recording as well. It goes on our YouTube channel, and that is open to the public. And there you go.
Yay. Why don't we go to the next slide, since that's just the introductory slide, and we've, I think, gone through that. Okay, we want to start by saying that we know some people have been very acutely affected by this very, well, somebody called it a wicked bad virus. And we want to say that if you have been, you have our sympathy. It's been a really tough pandemic for us. We also know that whenever we give a talk, occasionally we may say something that touches a raw nerve. We're going to try to be sensitive to that, but we ask right now for your forgiveness if we happen to touch something that's a raw nerve as we're trying to explain what's going on. The other most important fact to start with is this is still a new virus. It has a lot of unusual properties, or I should say, an unusual combination of properties. So we are all doing things and making mistakes that we wish we hadn't. So if you have, please forgive yourself. And if you have friends or family who've done something that you think they shouldn't have, please forgive them as well, because we're all going through this together. Next slide. The other thing, as Lynn sort of mentioned, is that this is still a very new and different sort of virus. We're still learning about it. As you'll see in a moment, not only did we have what we thought was a finished presentation on Monday, but then the CDC guidance came out, so we've added slides on that. And the one thing that I can guarantee you is that things will still change, information will change. It's been just a year. We don't have much data. We don't have all the data we would like. So all we can do is tell you what we know as of today. Next slide. So as I said, we were all prepared Monday morning, and then of course, CDC came out with, and I've emphasized in red sometimes things here that I want to make sure you get, that this is interim public health recommendations for fully vaccinated people, and they say, and these are quotations directly from the guidance, which also will be posted if it isn't already. This guidance may change over time. I expect it will change over time. The second thing is this guidance is for non-healthcare settings. That's important. They're not talking about hospitals or assisted living situations. Then as a number of us are fully vaccinated, yay, hooray. And that's what they're trying to address. What difference might that make in our lives? One of the big ones that a number of us have been celebrating is that if we're talking about a group of people, all of whom are fully vaccinated, and we'll talk about what fully vaccinated means a little later on, we can meet indoors without wearing masks and without physical distancing. Now, the next two points, we're going to start discussing these sorts of what other conditions have they looked at and what does it mean? Okay, they say that if you are visiting unvaccinated people from a single household and those people are at low risk of severe COVID-19, then it's possible to visit indoors without wearing a mask. That it's okay then to not quarantine if you've done this visit without necessarily testing, or if the person you visited is asymptomatic. So if there's somebody who's tested positive, you don't have to quarantine. Now we're going to get back to that a couple times, so hold on. I want to go to the next slide, which is from the guidance. This is also posted separately, will be posted separately, because I think it describes carefully some of the nuances. If you notice, the green dots are if you're fully vaccinated. The solid orange dots are if you're unvaccinated but at low risk. And then the open are either unvaccinated at high risk or unvaccinated, high risk, and not at home. But as you'll notice, those tend to be, the open tend to be very similar. If you notice, the only major change here is if you are two households, everybody's vaccinated, or two households, one household fully vaccinated, and the other household contains some It can be one, it can be more than one person who's not vaccinated, but who is at low risk of getting the virus. And excuse my phone, it'll stop in a minute. If you notice on the other ones, the issue there is that if you want to get together, the rules have not changed. You still are supposed to be masked. You still should be outdoors or in a heavily ventilated area. You should still social distance. You should still wash your hands. And the important thing is for all four of these, it's and, not or. Because I've noticed a number of people who say, well, I'm outdoors, I don't need to wear a mask. Well, these are all ands, not ors. Next slide, please, Lynn. Okay, so even if you're fully vaccinated, just as the other graphic demonstrated, I want to say that the first point is you're still supposed to take precautions. Now, I highlighted well-fitting mask because one of the other discussions we've had in our Thursday, and this you can get other documents online about, if your mask has gaps, those are gaps in which the virus can come in. So how well your mask fits against your face, all of this is very important. The second bullet is what I talked about before, maintaining the precautions, even if you're fully vaccinated, if you've got people who are not, and are, especially if they're at increased risk of getting the disease. They still say avoid medium and large-sized in-person gatherings, even if you're fully vaccinated. And obviously, if you get any symptoms of COVID, you need to get tested, as will come up again. Just because you're vaccinated doesn't protect you 100% against getting the disease. Okay, next slide. Here's the other quote, another three quotes. One is that fully vaccinated people should not visit or attend gatherings if they have tested positive for COVID-19 or have symptoms. Again, just because you're fully vaccinated doesn't protect you 100% against getting it or being able to transmit it. The latter we just don't know about. But, and this is a big one, especially for people on this call, fully vaccinated grandparents can now visit indoors if they've got kids and grandkids who aren't vaccinated yet, assuming everyone's at low risk for getting the disease. And low risk includes things like not going out to potential super spreader events. Another important point is, as of now, this guidance doesn't change any of CDC's requirements or recommendations with regard to travel. Next slide, please. Now, this whole issue of when you do or don't need to quarantine has been a big issue in the news, so I want to take a minute to clarify it. It's true, as it says here in the quote, that fully vaccinated people with no COVID symptoms do not need to quarantine following an exposure to someone with suspected or confirmed COVID-19. With the qualification, if as the risk is low. But if you remember from the previous part of the guidance, they said under these conditions, because you're meeting with somebody who has high risk of COVID or is known to have COVID, you should be wearing your mask, maintaining physical distance, and practicing other protective measures. So, as some people who are on this call know, I'm a little uncomfortable with this, but I understand it because if you think for a moment, we've all been coming in contact fully masked, I hope, and socially distanced, I hope, with people who are asymptomatic. But one of the most nefarious parts of this virus is that we know that the main transmission of the virus is from people who have no symptoms. So we may have been already in contact with somebody who would test positive but hasn't been tested and does have asymptomatic virus. So there's a logic behind it. I'm a little uncomfortable with it, but I'm a whole less uncomfortable if everyone is still wearing masks outdoors, maintaining distance, than I would be if everyone said, I'm fully vaccinated. Now I don't have to wear a mask when I go visit my friends who may be COVID positive. So that's my interpretation of what's going on here. And they say, even if you don't quarantine, you should still be very careful, monitor your symptoms, and if you think it's necessary, get tested. So it's not a complete get out jail free card. Now just pause for a moment. Lynn, do we have any urgent questions before we leave the current guidance?
I don't have any questions in the chat.
Okay. We'll just keep going then. Keep your questions to the end. If somebody had something urgent, I wanted to go. So now next slide. Next slide, Lynn. So now this is where the talk was going to start, with a summary of what we were going to cover, important points. Your medical history is unique, and everything about this virus and how it affects you depends on your medical history. I don't want to know it. And it's going to be different for each of us. So you need to consult your healthcare provider if you have specific questions about your disease. That wearing masks, especially the N95s, or double masking, especially if, like me, my cloth masks are only 2 layers and I want at least 3, preferably 4. And as I said, and social distancing and washing hands. We are strongly encouraging people to get vaccinated. It's the only way we're going to cut down on variants, cut down on transmission, cut down on severe disease, everything else we're trying to do. There are a lot of questions about the vaccines, but this is a wicked bad virus with very complex, acute, that is short-term, and chronic effects, and we're still learning about them. We still don't have them all nailed down. Everything we know about the vaccines, the 3 that have been approved to date, make them appear much safer than the disease. And they are more effective than a lot of vaccines we've taken for other purposes. This virus it will continue to mutate. And the mutations, as we're all learning, have consequences. Next slide. Okay. Again, there's no one answer for everyone. We all have different potentials for exposure. I would say as of now, I don't think anyone is completely unexposed. You've got to have had contact with some virus particles. The good news is most of us haven't had contact with enough in a short enough time to get infected. You would all like to know what enough particles in how much time is required for infection, and we don't know that yet. The other thing we're all having to make choices on, especially those of us who are getting fully vaccinated, is what is important to us? Which potential exposures, potential for risk, are important to your healthy life, to your mental health, to your physical health? They're a bunch listed here. You may have your own. I wouldn't personally recommend doing all of the above or all of the below, but each of us has to decide what's important to us, as we decide every day in every action we do, what's sufficiently risky that we'll take the risk, what is too risky, we won't take the risk. Next slide. Okay. Short news of what we do and don't know. The bad news is, as I said, most of the virus appears to come from asymptomatic people. This is highly unusual. There have been other viruses like this, but it makes it very hard to track, very hard to avoid. And we're still learning, as I mentioned, about what short and long-term effects this virus can have. The good news is soap is one of the best disinfectants for this virus. It really works, and access to soap is prevalent not just in the United States, but around the world, though not as much as we might sometimes think. The other good news for us in the DC area, especially within DC proper, is our infection rates have been relatively low, and we have enough hospitals to accommodate the people who are ill. Next slide, please. This is a reminder in a form that has evolved over the years of my teaching that life is risky. None of us get out of it alive. We all make choices every day about what risks are acceptable to us. This is forcing us to make a lot of choices we haven't thought about, but we've made these sorts of choices before, so we should be able to make them again. Next slide. Okay. If you have any medical conditions that you think might affect, you might be affected by getting vaccinated, or you've had trouble with vaccines before, you need to talk to your healthcare provider. We're not going to provide individual advice. But these vaccines, the 3 that have been approved for use now in the US, have been vetted by the FDA experts and by an external panel of experts in this field. So they really have done a good job, as is required by FDA regulations, but they haven't just slipped through quickly. The ones we have so far, quite honestly, appear to be both safer and more effective than most of us were expecting the first vaccines to be. And that's in part because so many groups tried so many different types of vaccines right away. All the data we have so far says that the vaccines are safer than getting the disease. You cannot, and this will come up a couple times, you cannot try to compare the vaccines. They each have different advantages and disadvantages. I don't think we'll have time to go through all of them, but they're different. You can't just compare on the basis of one number or another. As it says in the next bullet, they were looked at different times. So there were different variants that they were looking at. There were different populations with slightly different procedures. The Johnson & Johnson included people in the Northern and Southern hemisphere, so they even had people in different seasons. And as we know, we do different activities in different seasons. So you just can't compare the numbers one-on-one. But it's very important that if you do get vaccinated, you keep a record of it. We highly recommend you send a copy of it to your healthcare professional, in part because that way if you lose it, somebody's got a copy of it, in addition to taking a picture of it or making a hard copy of it yourself so that you don't have just the one copy. Next slide. For a long time, as a risk assessor, I've said numbers are less precise than they appear, but recently I was rereading this book, and this was, to me, a perfect example that everyone can understand. If you have an archipelago of islands, how many are there? Well, you have to define what you mean by island. Do you require that it have its own source of water? Or do you only require that a certain amount of it be above the water? But then what happens when the tide changes? The number of islands will change. This is true actually of a lot of the science experiments we're relying on right now, the data we're collecting right now. It has enough variation in it. We don't have enough of it. We don't have enough people involved in all the testing to really nail down the numbers precisely. So the difference between 80 and 90% of whatever really doesn't matter. It's not, the numbers aren't that good yet, and they're not going to be that good for a while. Next slide.
Now it's my turn.
Right, I'm sorry. I was just going to say, now I'm going to pass it over to Pam.
Thank you. Well, many of us have already had our vaccine. We still need to continue our general practices to limit exposure. Of course, we've gotten the new FDA, the CDC guidance that was put out on Monday. The vaccines do take time for it to be fully effective. For the Pfizer and the Moderna, they believe at 2 weeks. There was an article, a research article that I read that said after 22 days, the Moderna and Pfizer were optimally effective. The Johnson Johnson / Janssen, in the CDC guidelines, they talk about 2 or more weeks. And in an article I read in the Mayo Clinic yesterday, they were saying 4 weeks is optimum. So after your second of the mRNA vaccine, 2+ weeks, and after the Johnson & Johnson, please give it a little longer, possibly up to 4 weeks before you feel safe. The vaccines, as we know, are not 100% effective, and that's why we say to continue your basic practices. We don't know how long the immunity will last. This virus has only been out and about in people and being studied for only 1 year. So we know that for most people, the immunity will last for up to a year. In the Spanish flu of 1918, 1919, several years ago, they had a patient who had the Spanish flu back at that time. And when they drew her blood, they found immunity was there. We could only hope that our immunity would be that good across the spectrum of all the vaccines, but we don't know. Most people are talking about the possibility of an annual booster, but we'll have to stay on top of what the scientists are finding out. Vaccinated people may be able to spread the virus to others. They do believe that it is colonized in our nose. That's why the masks are so important, especially to cover the nose. Who hasn't been to the grocery store where you've seen people carrying their mask someplace over their lips or down on their chin? But the nose seems to be the most offensive for people to cover. But that is the place that we believe that the major colonization is going on. And that gives reason as to why one of the early symptoms for many patients who did get the COVID-19 virus and became ill with it, that they lost their sense of smell. I heard a patient say, a doctor said every morning he did a coronavirus test by seeing if he could smell his coffee. Of course, you know, that's a little bit facetious, but he would wake up in the morning and kind of check it out to see if he could smell his coffee. We are still learning about the potential long-term effects of the infection. They're called the long haulers or long COVID. And their symptoms, and it doesn't matter, it doesn't seem to matter as to how bad an infection and how seriously or not seriously ill they were. And the typical complaints are continued fatigue, muscle weakness, fuzzy mentation, that they aren't as sharp or they're not able to keep concentration for a period of time that they were used to in the past. Physical therapy, mental therapy has been helpful, but it is chronic. These people are, many of them, it takes more than 6 months for them to recover from this. And next slide, please. The four main categories. There are many categories for the coronavirus vaccine. The four main categories that I'd like to discuss is the first one, the Pfizer Moderna, is the messenger RNA, and they use the nucleic acid that the cells use to make the spike protein. There are no live components of the virus, so there's no risk of patients getting the actual, that the vaccine will trigger the disease. Some people who are vaccine hesitant are afraid, oh, you're gonna give me, I might be vulnerable that you would give me the coronavirus through the vaccine. So it is the nucleic acid or the messenger RNA vaccine is a Pfizer Moderna. And since there are no live components, this vaccine type makes it safe for people that are immunocompromised. The next category is viral vectors. Now, Johnson & Johnson and the Oxford AstraZeneca they use an inactivated virus that is not COVID to carry the DNA. It can be stored up to 3 months, and it doesn't have to be frozen. It only has to be refrigerated. So we're very excited about this, that it will be able to get out to remote areas. It'll go out to not only in the United States, but worldwide, hopefully. And this is so important in stopping the cycle. They said that the Spanish flu went around the world twice. And today we are a lot more travel dependent economies, and the expectation of people of moving about and going around the world is much more than in 1918, 1919. So we need the world to be vaccinated. It was good news. I heard this morning that Biden was able to secure another 100 million Johnson & Johnson's vaccine. And it seems to me as though the United States is going to have more than many vaccines availability than we have Americans. So hopefully those vaccines will be shipped out and given and utilized in other countries, because we need to stop it in Africa. We need to stop it in every continent, so it will not come back to us. The whole virus vaccines use a weakened or a deactivated version of the virus. And an example of that, we have used this in the past, and influenza vaccine is that it cannot be used for compromised people, compromised immune suppressed people. The last one, the protein subunit vaccines, they use a select fragment of the virus, and it's knowledge that we have used with hepatitis A, pertussis, diphtheria, tetanus. It too should not be used for immunocompromised people. I'm kind of particularly excited about this one. It is the Novavax. It's a Maryland company, and they are a company that has been working on this, on vaccines for quite a while. They have never had one that has been particularly effective, but they have thrown everything into production of this, and they are coming along very soon, and they will be able to provide more vaccines for all of us. Next slide. Here we are, Wellness Wednesday, and our village, the Georgetown Village, and our ED, Lynn, has been exceptional in getting reaching out to each one of us on all the different levels that we've needed. When you think of it, many of our villagers are not comfortable with computers, and Lynn immediately, what she was able to do was, once we realized that we had to suspend programs. So what were we going to do? She made telephone buddies for people with their isolation. She helped people when the vaccine was available to get appointments, get rides to the appointments, have follow-up checks, help people to remind them if they were getting the 2-dose. She would have staff or herself, she would call and remind them and ask if they needed transportation to their appointment. She's fielded many questions of individual members to Resha and I, and was just there as a ear to listen to them talk and help them through some of their experiences. And the village has been a fabulous outreach to our members. And the wonderful part that I've learned is how much the various villages that Lynn will network, and all of you have worked together. It's really very nice. Next slide. So I guess I kind of talked about this already. We do Zooms, and when we could no longer do the meetings, coffee chat or book clubs, discussion groups, we had to go to Zoom. And as I mentioned, many of our members are uncomfortable with the computers. So what did Lynn do? She set up sometimes one-on-one IT sessions. She had groups of Zoom classes, and has gotten almost everybody competent, comfortable, and if not, she's there to answer the phone, and Varnita as well to answer the phone and help all our members. Next, we need to, during this time, we have to optimize our own health, maintain your health appointments, your regular routine health appointments. Please don't forego your routine mammograms, your blood work, your annual physicals. If you've been advised to have physical therapy, please discuss it with your provider if you're anxious about it. Maybe there's a certain time that you can make appointments where you would be more comfortable. And now that hopefully, I think, Lynn, you've said that 89% of our members are vaccinated. So most of our members are vaccinated. That when you're out and about in public, we talk about if it's in a crowded situation, double masking or the N95. But please maintain your routine exams. In general, to optimize our health, it has become aware that vitamin D is an important factor in our metabolism. And typically physicians and providers will check your vitamin D level. The optimum level is 50 to 70 nanograms per milliliter. It's a blood test. And once your level is determined, then it may be suggested that above and beyond your routine multivitamin, that it would be suggested that you take a certain amount. I can't tell anyone what your certain amount should be on a daily basis, because it will vary depending upon what your vitamin D level is. And we have found, or the researchers have found, that patients are more vulnerable to get the coronavirus if their vitamin D level is low. If it's below 30, they tend to be more vulnerable. Improve your diet overall. Think of the grains. What did you have for breakfast? What did you have for lunch? What are you going to have for dinner? Can you think of grains, fruits, vegetables? Limit the meats. Try and do more fish, and avoid sugars. Consider regular addition of yogurt. Yogurt is high in protein, high in calcium, good for vitamin B12, and when plain, it's low in calories. Besides that, it's not a very expensive item, so it's a great source of protein. And as seniors, we need somewhere, depends upon your weight and your activity level, we need somewhere between 60 and 70 grams of protein a day. That is hard to get if you're not eating right. So look at the label. And sometimes I grew up counting calories for weight issues. But I do like to count protein amount, and my target is 70 a day. Yogurt may also have a positive effect on the immune system, cardiovascular system, and overall metabolic health. So it's a great one. Take time on a daily basis, multiple times throughout the day, to stop, look around, take a deep breath, look at something simple, look out the window, look at a cloud, refocus yourself. If you're beginning to feel a little stressed, there are so many things we can be thankful for. Just a pretty color, a soft fabric, a phone call from a friend. But be grateful and stop to think of your blessings and try to put down the worry of this disease. Exercise. The best exercise is one that you will do regularly. Walking outside with a friend will hit many of those bells that I've spoken about. Next slide. We try and do everything we can to optimize our health, but things happen. And this little prose from William Freudenberg, that which hits the fan is not evenly distributed. We do the best we can with what we do have, and we'll go from there. Risha?
Before you finish, before you go to Resha, rather,
Yeah. Yeah.
We did have a question. One of our members asked that you talk about the nose wash.
Yeah. So in head and neck surgery and in head and neck discipline, they will do nasal rinses depending upon what the issue is. Just maybe salines, little salt water to flush out, say like if you have allergies or you have a lot of congestion in your nose, to flush out the thickened mucus, or to wash out the pollen. That's great. The coronavirus has a spike protein, which is easily broken down. It's a lipid protein surrounding that spike. It is easily broken down with soap. And as Resha said, the best thing you can do is to wash your hands. And the reason for that is the soap will break down the lipid capsule around that spike protein. It is the spike protein that's the attachment vehicle to get into our body. So if you feel that you have been exposed to somebody, or if you're on an airplane every 2 hours, hour and a half, you might consider rinsing your nasal sinuses. To go farther, in some of the pre-op preps for surgery, for nasal surgery and sinus surgery, they will put a little bit of betadine in the salt water. It's also recommended, betadine is an antiseptic. It's it's brown in color, and when it's diluted, it's kind of a murky, mustardy yellow color. It stains your clothes. I am not recommending betadine. But what they also recommend is Johnson's No Tears shampoo, a little drop or two in about 4 ounces of water, where you can rinse your nasal sinuses, and there you go. It is soap and salt water, and you can reduce your chances of, if you have inhaled the coronavirus, you can rinse it out. Simple, very simple. Any more, Lynn?
That was it. Thank you.
You're welcome. Now, Resha, is going to talk about considering registering for the CDC's V-Safe.
Yes, I'm going to go over this very quickly. You do need a smartphone. It is HIPAA compliant, so your personal information is as safe as it is in your doctor's office, which has to comply with HIPAA. They will monitor you initially daily, and then if you don't have symptoms, less frequently. If you get a second shot, you re-register and they start again with daily. If there's anything that they're concerned about, they'll call you and talk to you about whether you should seek medical protection. But the main reason I, as a scientist, want people to register for V-Safe is that they're collecting this information to find out more about what's going on with the vaccines in terms of both symptoms from the vaccines and people who may get sick after being vaccinated. And they've already begun to put out some of the data that they have in their weekly document, Morbidity and Mortality Weekly Report, which is available online, free to everyone. And you can search for COVID and get some of the topics that you might be interested in. Next slide.
Right, there you go.
Okay. The bottom line that everyone wants to know is, am I safe? And the answer from a risk assessor point of view is, none of us are safe, which is why I started with that with the life is a sexually transmitted condition with 100% mortality. But I want to use this slide to show you that you already are making these sorts of choices. We just have to apply it now to the virus and the pandemic. But not all choices are the same. And that's getting back to the previous slide of Bill's, that which hits the fan is not evenly distributed. Some of these trade-offs are easy. Every time you take a pharmaceutical, vitamin, food for that matter, it changes your body. It has effects. But the risks and the benefits of taking a medicine your healthcare professional suggests or requires occurs to you, so you can make that choice. You have the risk, you have the benefit. Other things, especially things like vaccines, is an example, again, I've used for a long time. We know vaccines are good for society. They prevent the illness in most people. They prevent the illness from spreading. They prevent mutations. The benefits to society are huge. As we also have seen in this vaccine, as with other vaccines, some people will have a reaction to the vaccine. Which reaction and which people depends upon the vaccine. Then it's not the same for all vaccines. But this one is a harder decision because the people who react to the vaccine, and we often don't know why they're going to react or why they did react, but they're likely to be different than the people who will get the disease. Because we also don't know why a lot of people are more susceptible to the disease. So that's a harder trade-off, but it's a different trade-off. The one is an individual trade-off, the other is a societal trade-off. And risk assessors and communicators get into decisions such as how do we make, as a society, the second sort of trade-off. Again, that's a different subject, not for today, but I wanted to point out this difference to you. The other thing is, even for an individual risk, some risk, the first one, by the way, is called either risk-benefit or cost-benefit analysis when it's done officially. This other sort of thing that we often do is a risk-risk trade-off. And the two examples I've given here illustrate that can be, in some cases, again, easy, and in some cases, difficult. There was an international speaker who was talking about the potential carcinogens in our foods, and someone said, but you've named off virtually everything. What should we eat? And his answer was, not eating has acute toxicological consequences. There are people who die every year choking while eating food. We have statistics, and yet most of us choose to eat. The harder trade-off, even on a risk for an individual, is, for example, a pharmaceutical where you have two choices, and one might cause effects on the kidneys and another might cause effects on the liver. Well, if, like one of my relatives, you have a family history of kidney disease, you probably don't want to take the one that affects the kidney. If, like most of us, you don't have a family history of either, you have to stop and think. And there's a lot of other bits of information that may come into it. But again, we make these trade-offs all the time. They're more difficult right now because it's a situation we're not used to, but they're the same sorts of trade-offs. So if we can go to the next slide.
Before you do, I think you have a question.
Okay.
Tony, is that your hand up?
Yes, can you hear me?
I can.
Okay, it's a little bit off of what Resha is saying right now, but it's probably more for Pam. We heard a lot about the National Guard being all around Washington, et cetera, and yet they don't have a very high rate of being vaccinated. And I was told that that is because you can't force the military to get vaccinated unless the vaccination has passed its experimental phase.
It's not that it's past its experimental phase. These are all under the emergency use authorization, which
Right.
means it isn't a full approval.
So when will
It's
that,
past its experimental, the experiments have been done, but it hasn't been given a full approval, and therefore it can't be required by the military.
okay, well, when will they get over that hump and the military will require it?
I don't actually know offhand the information required for FDA to change an emergency use authorization into a full approval, but I can,
Okay,
either I or you can look up on the FDA and you can get that information.
okay, thank you.
The next to the last slide, and then we can open up for discussion. And if Lynn's willing, I can stay on at least for a little longer. This is an economist. My husband was an economist, so I got this quotation. This is true of a lot of life. There are no solutions. There are only trade-offs.
That's a good one.
Okay, handing it back to Pam with the next slide.
Yeah. So now we're at the summary. Well, a lot of information has been covered today. We're being bombarded in the newsprint and on television and in discussion groups about the coronavirus and what should you do. And as Resha pointed out, it is unique to you. What is your medical history? What do you need in your life? But in general, we want you to continue to, when you're out socially or in public, as they say, please be wearing a mask, social distance, wash your hands. When you have choices, make sure it be in adequately ventilated rooms. I heard on television, they were recommending in the schoolrooms to open the windows. And that's kind of interesting. But the idea, the concept is there, is good ventilation. In general, we are trying to get everyone vaccinated and to educate those that are resistant. Tony brought up about the military. About a third of the military are vaccine hesitant, meaning it has been offered to them, and approximately 33% of the soldiers have turned it down. So it is all of our jobs to try to break down some of the barriers. And it's good that we see these faith-based groups and local people going out to the community, trying to get their neighbors educated and more comfortable. And I'm really hoping with this Johnson & Johnson, I may have said before, that one and done, one shot, you're done. You don't have to come back. No one's going to be following up with you necessarily unless you do a V-safe question, it might break down some people who are vaccine hesitant tend to say, I don't want anybody following me or chasing after me or telling me what I have to do. And so that might be good. Do we have any questions?
Let me stop sharing so we can see everybody. There you go. And thank you everyone for joining us. Are there any other questions for either Pam or Resha?
Not for me.
Thank you, Tony.
Looks like Sarah has a question.
Yeah, Resha, one of those things, one of your slides at the very beginning, it said, if you see someone who has not tested positive for the last 10 days or something, I'd have to go back and reread it because, for instance, my question is, my children, two of my daughter and her daughters are driving now from Connecticut, and they're going to be tested before they get here. So they're going to probably be tested on today because they're leaving tomorrow. And if it'll probably be negative. Okay, so now, does that last through the weekend or what? I'm confused after watching that slide, but maybe.
Yeah, okay, it's slide number 7. If you want to put it up again.
I'm looking, okay.
What I did there is I quoted directly from the guidance.
Okay.
And I only got the guidance yesterday. So interpretation of some of this is still going to be up for grabs and will probably be modified based on various things we hear from people. This is the first point that you were making. What you have to understand about testing, prior slide, Lynn, or the next slide, that's one.
That's it.
Yeah, okay. So first of all, the testing is only good for the day that you got the test.
The moment.
Oh, I see. I misinterpreted this one.
Yeah, okay.
Thank you.
So if they had tested positive in the prior test or experienced symptoms, though, they are saying, okay, this person might have the virus. We don't know, but you should treat them as though they might have the virus. What does that mean? Well, if you're fully vaccinated, according to the CDC guidance, and you both are wearing masks and socially distanced and outdoors are fully ventilated and you wash your hands and all those things, then you don't have to quarantine after you visit them. But you should treat them as though they might be positive. If they test and they're negative, how good is it for? Well, they were negative then. What have they done since the testing time? And if you're gathering, what I would recommend is A, that people get tested, B, that if people are negative, they still decide to isolate as much as they can until the gathering.
Right.
As much as they can depends upon the situation. And then you as a family group have to decide whether you're comfortable having that person come to the group. Each group has to decide for themselves what makes sense to them and how important it is to get together. I don't have kids, but I have a lot of friends who haven't seen their kids or grandkids for a while. I've got to imagine that's very important.
Yes. Well, we're going to do most everything outside, and if we do go inside at my son's, we'll keep the windows open and we're all wearing masks, so like we did at Christmas. But the another question that's just gone out of my head. Sorry, so carry on.
It's always tomorrow.
What?
There's tomorrow for us. Everyone who's still on
Oh,
here.
I remember when I just went to an ENT, and I noticed she has a HEPA gizmo in her office. How much are those, do you think, dollar-wise?
What do you mean gizmo?
Well, it was like this. It was like this. I've got a picture of it I can send you.
Right.
Thing and it said HEPA.
It's a HEPA air filter.
It's an
Yes.
air purifier is what they call
Yeah.
it.
Thank you. Let me just
It's
see.
like one for the office that has a HEPA filter in it.
Can you see this? This is what it is.
Yeah, it's a air purifier.
Okay, now, when you said that, it occurred to me, that I'm wondering if it's like $100, it would be worth it to take to people's houses like for Christmas and to put it into a room just to add on to the airflow, as it were. And that was my thought today as I was sitting in the doctor's waiting for her.
I think that's a great,
Yeah, I mean, how much they cost depends upon size and everything else and who's manufacturing it, how good they are. The one thing I would be careful of, as I would recommend also about masks, we know that there have been fake N95 masks that have been sold online. So you want to be careful to make sure you're getting, the cheapest one may not be necessarily the best one. I don't know whether anybody has certified yet HEPA's. They should be good for the size of the virus particle, but you can check the size of the virus, but mostly the virus also attaches to other things, so they will get out other particles. Also, you have to change or clean the filters, because if you don't, they'll clog up. So you have to know what it is, use it properly. Can it help? Yes. How much is it going to cost? How good is it? How much air can it handle? All those depend upon the individual machine.
Thank you. Okay.
But it couldn't
I'll
hurt.
go into Consumer Reports and see what they say.
Yeah.
Sorry.
Okay, everybody seemed to have signed off, but on their way out, they put in the chat, thank you very much. This was an excellent presentation.
Oh.
Really appreciate it. So
Hey,
you should
yes.
know it was well appreciated. And I did record it. It will be up on our YouTube channel in a few days, and it will be accessible. The slides will be up on our website
Thank
in
you.
our COVID resource section. So thank you both.
thank you, Lynn. Thank you, Risha.
Well done, guys.
Bye.
Very well done. Excellent.
Glad to do it.
Talk to you tomorrow.
See you tomorrow. We'll talk to you tomorrow,
Okay,
right?
guys.
Yeah, thanks.
All right.
Bye-bye.
Bye-bye.
Bye.
Thank you. Thank you, guys.